lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5. Now this two first line I told you, this is the lumbar 4, 5, but till here the lumbar 5, because here it will start the sacrum, slightly it get changes of the person to person slightly. Now this is L1, L1, L2, L3, L4, L5. So now there are the 5 bones. Now what are the indications? These all are thoracic nerves, splanchnic nerves and intercostalis nerves are passing from here to here. Now this is the lumbar nerves. This is the lumbar nerves, especially crossing from this direction and also crossing to this direction. Now half tune lateral. Where is the acupuncture points are located? This is the acupuncture point L1, L2, L3, L4 and then L5, right? This is the L5 points. Now we have to insert the needle in this direction. Certainly we can use L1, L2, L3, L4, L5. Be focus and concentration to be done here. If the patient is complaining about the pain on my upper part of the thigh region, the patient is complaining here upper part of the thigh region, that indicating that L1 is affected. When this is upper part of the thigh, if this is the middle part of the thigh is affected, then the L2 is affected. Then the patient is complaining about the superior part of the knee, patella above the knee having the pain, that indicating L3 is affected. Then the L4 is this is the region of the L4 region, where the medial malleolus, the pain on the spleen meridian, the pain on the kidney meridian, the pain on the liver meridian, below that on the medial side of the leg having the pain, that indicating it is related to the L4 nerve is affected. Then the problem is on the anterior tibialis muscles. If these muscles having the pain on the anterior tibialis muscle, that indicating L5 is affected. The great toe to be known as a L5, right? Till L5 you look at about the lower extremities, especially from the ventral. This means this is actually dorsal region, but this is the ventral region, this is the dorsal region, but this is the ventral region, and this is the ventral region, this is the dorsal region. Here is the opposite. Now the dorsal side of the lower extremities can be treatable by activating this L1 to L5 region. L1 to L5, the dorsal side or the upper part of the thigh, middle part of the thigh or the knee region, the medial side of the downwards direction of the leg and lateral side of the leg. That means here, from here to here maximum you can treat by activating to the L5. Now we wanted to see the sacrum level, the sacrum 1, 2, 3, 4, 5, 6. So this is you can find there is a hollow depressions here. Everybody you can see that there is the depressions. How this I told you, there are the eyes. The eyes we do have 2. The knees also having the 2 eyes, and also nipples are 2 is existing. In the similar way, the back of the region, especially this is area to be known as a holy bone. So on the holy bone there are the 2 eyes are there. That eyes are to be known as a right eye and then left eye. Right eye and then left eye. So these eyes are predominantly, we can use it, this right and the left eye, so bilaterally to treat for the sacrum 1 vertebra. This is the sacrum 1 vertebra, this is the sacrum 2 vertebra, this is the sacrum 3 vertebra, this is the sacrum 4 vertebra. Right? These are the sacrum bones. You can find that this is the bone to be known as a triangular bone, vertebra, right? So now this is the depressions to be known as a S1 sacrum. But here you come to the closer, that it means is the half zone lateral to the, because so many vertebrae having the lower border of the spinous process. But whereas in here we don't have any fused bones are there. There is no lower border of the spinous process. Immediately that locations are here. Now we apply, this is S1, S2, S3 and S4. This is the S1, S2, S3 and then S4. So till here you can find this is the S4 vertebra, S4 nerve, because slightly lower you will get, this is the point, this is the point, this is the point, this is the point. You find out, and then you find out the second hollow, you find out the third hollow, you can find out the fourth hollow. Very micro level, you look at about the pubic bone, you come to know there is a hollow. So the hollow is here, but we apply half zone lateral to this region, but bilaterally can be recommended. If this is S1 problem is there, then sacrum 1, this area to be known as a sacrum 1. S2, this area, total area to be known as a sacrum 2. Hopefully you understand. This is the area to be known as a sacrum 1. This area to be known as a, that means gluteus maximus, gluteus medius, gluteus minimus muscles. All these muscles to be known as a sacrum 1 and then sacrum 2. Now you come to this region. This region, half of the region is the sacrum. This the half of the region is sacrum 2. Sacrum 1 and then sacrum 2. It covers from here till from the. So now you can see this is the hamstring muscles. Now hamstring muscles outside where the pinky toe is there, that pinky toe side is the S2, the inside is the S1. Now the entire area, now we look at about this divided into two. The hamstring muscles are called as a biceps femoris muscles, semimembranosus muscles and semitendinosus muscles, collectively known as a hamstring muscle. These hamstring muscles are divided into two, that means is the right side and then left side. These are the muscles are collectively treatable by activating the S1 and S2 nerves. Then the popliteal fossa, if there is a Baker cyst is there or some kind of the popliteal cyst is there, or the patient is complaining, I do have the pain on the flexion and extension, that time the patient is pathetic pain on the popliteal fossa, that also treatable by activating to the S1 and then S2. Then patient is complaining, I do have the pain on the ventral side, patellar region I have the pain, then it is indicating to the L4, not the other vertebra. L4 vertebra is recommended. Then the medial side I do have the pain, again it is the L4 vertebra is included here. If the pain is on the lateral side where the stomach meridian is there, then the L5 vertebra is included here, right? So in this way you just come downwards direction, and then further you can look into that. The patient is complaining about the sole of the foot region, especially on the pinky toe region. If the pain is half of the sole, if the pinky toe and then the fourth and then third toe, if the patient is feeling the pain or numbness, that time we try to find out, are you feeling sensation, Natraj? Yes, sir. If the feeling sensation is there, nerve impingement is not there. When he do have the pain, then you treat in the same side of the myotome, that will releases to the nervous system, to the muscular system. Where the hardest fascial tissue, plantar tissue is there, that get the stiffness which causing the pain, that time you just activate, that you are activating to the sural nerve. Once you activate there, you are activating to the plantar nerve. So in this way we are activating there to release this. But when the patient is complaining, I do have the pain on this specific region, that indicating it is connected to the S1 vertebra. When the patient is on the dorsum of the foot is complaining about on the great toe, I could not do the flexion and extension is not possible, that movement is very poor, my numbness is there, sensation is very weak, that indicating the L5 vertebra. L5 treatable for the dorsum of the foot region, and then then the sole of the foot region. Even diabetes patient, they says that I have the diabetes neuropathic condition, I don't feel anything. Precisely you just activate on the S1, sacrum 1 and sacrum 2 region, that precisely that the sensation will pass on to this region. But however, the diabetic neuropathy, it is connected to the mild to moderate problem. When the severity is there, that indicating, let it be like this, when there is the dendrites and axon, that axon and neurites and need to be connectivity each other to transformer, the transmission to be taken place each other, the neurotransmitter junctions, because the synapses connect each other to create the chemical changes to be taken place. But if these dendrites are not communicating each other, for example, there is a connectivity is there, one or two is disconnected, then you understand, you can treat. But when there is the only is one hanging, that means all the neurons are left, dendrites are left, that means it is really great difficult. Even you can activate there as well, because when there is the myelin sheath is there, myelin sheath having the electrical conductivity to be taken place. If there is no in the axon, there is no myelin sheath in the neuron, that time it's having the great difficulty. By the way, you can also try to apply, these are the points, even for the diabetic neuropathy, partially we can sustain to the same level, at the same time 30 to 40% patient feel lot of changes. Even for the diabetic conditions, even the barefoot walking on the grass, green grass, natural grass, that also really will be helpful, like a foot bath therapy, or maybe we call as the barefoot therapy, that also recommended here. Hopefully you understand the lower extremities are treatable by activating to the how many vertebrae? L1, L2, L3, L4, L5, then S1 and S2. There are the totally 7 nerves are activating. Once we activate this region, of course this also activating to the femoral nerve in the ventral side of the body, but here also there is a peroneal nerve, and then sural nerve will activate here. But in this side you are activating the saphenous vein and saphenous nerves will be activated in this direction. When we are treating here, there is a artery which supplies to the knee region, that's called as a genicular artery, that also we are activating through that. Of course we can use it those points, at the same time we wanted to use as a local points on the motor points, which is applicable on the, for instance, the patient normally will have the pain on the hamstring muscular pain. That time the biceps femoris muscle, these muscles are called as a biceps femoris muscles. There is the single nerve is supplying to that motor nerve called as a, especially that particular muscles, there is a one nerve is passing, that nerve is passing to the biceps femoris muscle, that called as a motor point. So that motor region 3, 4, 5, so exactly on the 6 tune proximal to the popliteal fossa, there is a motor point. Activate one motor point here, giving the signal to the brain. From here signal is getting to the affected area, the patient feel lot of changes. You activate here, at the same time you are activating as a local point. There is no acupuncture point, but only the point is the motor point we can activate. Each and every muscle having one motor point on the central bundle of the spindle of the muscles, there is a motor point. In that you just activate, certainly there is a great changes to be taken place. Hopefully we completed the head and neck region and also abdominal region, back region. Of course this back, when we wanted to integrate it, if we use back points, that also helpful to the back and also on the ventral side of the body. Now this is for the lumbar region, of course that also sacrum region, which is communicating to the entire system of the body. This is called as a dermatome, myotome, sclerotome, synditome, enterotome. Enterotome, which is gut. So which I told you normally, the brain and then gut axis to be taken place. How there is a connectivity based on the connectivity of the enteric nervous system communicating to the brain. If enteric is good, intestine is good, gut is good, through this only it will communicate. That's called as a mesenteric ganglion. Then the upper mesenteric ganglion, lower mesenteric ganglion, from here it communicates to the colon. From there it is communicating to the brain also. That's the reason there is a interconnected each other called as the enteric nervous system. Synditome, which is communicating to the especially for the tendons. neurons, whereas in sclerotome, which is communicating to the bone system. However, wherever we apply, dermatome, myotome is the key information. As a theoretical aspect, we understand myotome, dermatome, sclerotome, synditome, enterotome. These are the 5 tomes are there. That means is the 5 different segments are there, 5 different parts of the theory is there, but most of the informative theory to be known as a myotome and dermatome. Once we understand, definitely we can implement for the clinical practice for the day to day. That will be really helpful to the sick patients. Thank you. Anything else?